things must we do once we have identified that there is a disease? Do you know, or do you need some help from somebody else? Anybody wants to help? If not, go ahead
I
if you know the
I
person.
may not know all, but I may know one or two. But maybe
Sure.
somebody could help me. Somebody could help me.
Go ahead with what you know, my brother.
All right, you got identify the cause and stop doing what's dangerous to your body.
Mm-hmm.
And oh, somebody got to help me with the other two.
Well, thank you for your efforts. So, yes, we're going to identify the cause, right? And once we've identified the cause, we know what we're doing wrong. We're going to change those wrong
Right.
habits. Exactly. And then we're going to change also on healthful condition. It could be your environment, it could be whatever it is that you're doing that is contributing to that disease. And after we've done that, plus get out in nature, practice the 8 laws of health. And if we still need some help, we're going to help nature by adding some natural remedies. Thank you so much, my brother, for your effort. I know I volunteered you, but thank you for being a good sport. Tonight we have our presenter, Brother Salas, who is a health coach, medical missionary, and he's also a sleep health coach. You're having sleeping issues, is able to help to identify what the problem is, to help us to change the wrong habits and to turn around the situation so that we will start getting our sleep and restore the right conditions. So, Brother Salas, over to you, my brother, as we're waiting with bated breath to hear tonight's presentation.
Okay, well, good evening, everyone. It's been a wonderful week here out in the Northwest. So far, it has been a week of snow. Today, the sun is shining and the place is looking very bright and beautiful. The sky is clear, and I am grateful to God for the sunshine. Usually, at this time of the year, our vitamin D levels become a little lower because of the lack of sunshine. But so we thank God. We cherish days like these. We go outside and make sure we get enough sunlight. Well, I hope that those of you in Jamaica or wherever you are, that you're having good sunshine, good sunlight today. Take advantage of it. It's one of the things that will make sure that you have good health, and that includes your prostate health, because um, sunshine is beneficial to health on a whole. All right, so today we're talking about the prostate. I understand that a lot of our brothers have been asking for for something to be shared about the prostate gland and its health. So that's what we're going to do today. But I'm not going to do a lot of the talking. Um, I'm going to briefly give you an overview, and I want to make this relevant to your questions and concerns. So please ask your questions before I begin. Before I pray, I would like to see in the chat if there's anyone that have questions that they would like to ask. Let me know in the chat right now so that I can know that I have to make time for questions. Please indicate in the chat if you have any questions. So as we go along, we'll be able to address those. All right. I see no hands as yet, but I'm going to go ahead and pray. Dear Father in heaven, we thank you so much for gathering us together to learn more of our health. Lord, I pray that as we listen tonight and as I present tonight, that your Holy Spirit may lead and guide and direct me. You know, it's your desire, your plan for us to have good health. You know what you want me to share with your children here tonight, and I'm just asking for guidance. I'm asking you for wisdom, so that when this is done, we may all be able to leave satisfied with that our questions and our concerns have been addressed and answered. And we thank you in Jesus' name. Amen. Okay, yeah, Brother Cameron. Okay, Brother Cameron. His hand is up. So we have one person that will be asking questions. I don't know why everyone is so quiet tonight. Anyway, let's just go ahead. Okay. So, um, um, let me see here. I want to share my screen, and I think I have permission to share the screen, which I'll do that right now. Okay. So what's the prostate gland, and where is the prostate gland found? I remembered when where was I? I think I was in Jamaica at one time, and since a lot of our Jamaican brethren may be on this platform tonight, I'm gonna make this a little make some mention. I am trying to get to the top of my screen here to okay, there we go. Slideshow from the current slide. I just want to make sure that okay. So where's the prostate located? Where is the prostate located is the first question we want to answer. Now, in this picture, you'll see that what are we looking at? We're looking at the bladder. The bladder is the portion above this this little walnut shaped kind of thing. You see, in it's it looks like like a heart almost, the shape of a heart, and it's in two parts. And you notice a tube. There's this red tube coming down in the middle. All right. So first you have the bladder, and I'll show you that again. So the bladder is the first part you see, and then right under the bladder, you have the urethra. That's that red tube. I'm coming back here, and I'll show you that red tube that comes all the way down, and then at the right side of that is half the prostate, and then the left side is another half of the prostate. And then when you go down to the penis. All right, let me show you that again. So you have the bladder, then you have that little heart-shaped thing that looks like it's cut in half, and then you see that red tube coming all the way down. The red tube is the urethra, and the prostate is right there at the side. The urethra. Let's talk about the urethra. What's the urethra? A lot of times when men have prostate tissue, they usually have inflammation of the urethra, and somehow it's always usually connected. So the urethra connects the bladder, and it connects the bladder and its function. It connects the bladder with the penis actually, and its function is to empty urine from the bladder out of the body. So here you have the bladder, then you have that tube. Think of it as a hose, empty as a drain. The urine comes out of the bladder, leaves the bladder, comes through the urethra, and then it goes straight to the penis out of the body. The male urethra, so the reason why I'm specifying the male urethra because females have urethra. Once you have a urinary system, you're going to have urethra. But the male urethra also helps to transport semen. The male urethra is divided into three parts. The prostate urethra, that's the part that's connected to the prostate. And you have the membranous urethra and the spongy urethra. So those are the three parts of the urethra. And then you have the prostate. The prostate urethra starts at the neck of the bladder and is located in the prostate. Of course, that's why it's called the prostate urethra. So let me go back here and show you that picture again. So you see, you have that red tube that comes down, and the part that's right in between the prostate, that's that part of the urethra is called the prostate urethra. And it starts at the neck of the bladder and is located in the prostate. Then there are nerves vital to erections that go around the lateral edge of the prostate. The prostate also connects to the ejaculatory ducts and contributes to parts of the semen, production of the semen. So far, I'm sure you might be thinking, you might begin to realize that the prostate gland has something to do with sexual function. Also, the main function of the prostate is to help produce semen. It makes an alkaline fluid which mixes with sperm during ejaculation to create semen. The alkaline fluid helps to protect the sperm once it reaches a woman's vagina, as this is an acidic environment. So the prostate gland produces that fluid, which helps to keep the it's alkaline, and helps to keep the area. It creates an acidic environment in the vagina. The prostate produces a fluid called prostate-specific antigen, or what we know as PSA. So it produces this fluid, and this also helps the sperm by acting like a glue to attach it to a woman's cervix. The glue then dissolves, and the sperm is free to swim in the uterus to find an egg. So that's amazing. The what you call it, the prostate antigen, the prostate specific antigen. Um, that's one of its functions. That's to help to keep the sperm together so that it can be able to reach its destination. And once it reaches, then the fluid dissolves, and the the sperms are released, and they go straight, and we know that there are millions of them that reaches that egg. The main function. Okay, so let's go forward. Along with helping to make semen, the prostate gland helps to pump out sperm during intercourse. There again, we see that the prostate is related to sexual function. So the pumping action ensures that the sperm can travel far enough into the uterus to possibly find an egg. Now, those sperms are good swimmers, and they get the help from this pumping action, as if they almost as if they are propelled along the way, so that they with enough speed and force to find the egg. This experience makes sexual pleasure for men. So when you have that, when you experience ejaculation, there's this nice feeling that I don't think there's anyone can describe that feeling that you get after ejaculation, and that's what makes sex enjoyable. That releasing of the releasing of those sperms by the prostate gland, with the help of the prostate gland. So what are any questions so far? Does anyone have any questions so far? Any questions so far?
Yes, there is a question from Clive. Cameron?
Go ahead, Clyde. Okay. Are you there, Clyde? I think, yeah. Okay,
oh, I'm here, but I could not mute.
Oh, okay. Okay.
No, but I didn't have a question just yet. I was waiting until you're further in your presentation. Yeah. I just wanted to indicate. So no questions yet. I'm following you.
Okay. All right. So so yeah. So the reason why men usually want to know about prostate health is because statistics show, and we may have friends, family members, males who we have heard died of prostate cancer, or we may know some who have prostate cancer. Some of us ourselves may experience problems with the prostate, and so the cause for these concerns. Sometimes the women, wives, are usually concerned about the prostate health of their husband, because of the statistics showing that it's known that a lot of men die from cancer, and a lot of them are husbands and fathers also. So let's talk about some of the problems that surround the prostate gland. And so we have one of what I will call Faye, did you have a question, Faye? Did you have a question? If you do, Faye, you can unmute yourself and ask a question if you have one. Okay, I think she's trying to unmute herself. Okay, go ahead.
I can unmute. Okay, now, okay, thanks. Yeah, I just want to ask a question. How early can a man find out that they have prostate problem with the prostate?
how early can they find out, or should they? Are you saying how is your question? How early should they seek? To know? Should they
Yes,
try?
yes. How early can they know that there's a problem with their prostate?
I would think once you pass 40, um, prostate pros, prostate problems have been known to develop in later years, maybe 50, 60. According to the studies, according to statistics, a lot of times you prostate prostate problems are common in men 60, 65, but earlier it can happen. And what I've noticed is that there used to be a time when we were growing up, those of us who are past 50 years old, past 60, we can remember when we were growing up, people only came down with diseases when they were older, 60, 70. Now, even heart attacks are happening among people in their early 20s. Cancer. Um, just recently, I heard of a young lady. She was about 23 years old with breast cancer. So when I think about the age at which people are coming down with diseases, I am suggesting that as early as 40, men should start checking their prostate, and that's just my opinion on that. So especially men who have not been living a healthy lifestyle. If you're a male and you're not living a healthy lifestyle, you should be checking your prostate earlier than men are usually encouraged to do so. So I
So,
would say,
Dr.
yeah,
Silas,
yeah.
should I believe that it's very difficult to detect, or is there a warning sign?
Well, they're warning signs, and we're going to come to that in a moment.
Okay.
No, with medical technology today, it's easier to detect a lot of things even earlier, I believe. Okay, so the benign prostate hyperplasia, or BPH, which is also called an enlarged prostate, that's usually the one that brings more concern. Um, An enlarged prostate can cause many problems, including blocking the flow of urine, bladder problems, urinary tract, or kidney problems. So that's one of the reasons why we want to make sure that nothing is that there's nothing bad happening with the prostate because of the problems that this issue can cause, this enlargement. Most men, that's how they know they have a prostate issue, or that's how they will. That's the thing that will the symptom that will cause them to go and check if they're having problems urinating. Some having problems urinating frequently, or not having a steady flow. That's an indication. That may be an indication that the prostate gland is enlarged. Therefore, it's blocking the flow of urine. Um, Frequent urination can be due to bladder problems also. It may not necessarily be the prostate, but that's one of the signs. And that's one of the signs. I'm sorry, what did I do here? That's one of the signs of prostate enlargement. What I'm going to do here, I'm going to read to you. I'm going to share with you a list of things that can go wrong. A list of symptoms or side effects of prostate issues, as soon as I can come to my notes here. So this is just like an overview, a little partial list. Um, Pain, some of the symptoms of inflammation and inflamed prostate. So the prostate gland may be enlarged. It also can be enlarged and inflamed. And some of the signs would be pain or burning sensation when urinating. So if you have any of these symptoms, it may be wise to go and check it out. Don't just, once you're experiencing anything that's unusual to normal functioning, something that you may not have experienced in the past, and you notice all of a sudden that you're having these issues, it's important to go and check with your doctor to see what's going on. So you have pain or burning sensation when urinating, difficulty urinating, such as what's called dribbling or hesitant urination. And if there are any males here who have had these problems, you will know what I'm talking about. But you urinate and you know there is more urine to come out, but it stops. And then you have to squeeze a little, and then it comes again and stops. That's something that's not a good sign. Um, Frequent urination, especially at nights. Now, frequent urination at nights doesn't necessarily have to be due to a prostate problem. If you dehydrated, for me personally, I notice that if I'm dehydrated and then that day I decided I'm going to drink a lot of water, or I may forget, I may remember at, let's say, maybe 7 o'clock, 8 o'clock, I may remember, oh no, I did not drink enough water today, or maybe I only had one glass, and I will go and drink a glass or two of water. I'll be up all night. So it may not necessarily mean that I have a prostate problem, because I've noticed that the next day it's fine, the next night is fine. So I always try to remember not to drink water, remember to drink my water during the day and not wait till night. So frequent urination may not be a problem with the prostate, but if you see this is something is going on for a certain amount of time, every night is happening, and you look at your water habits and you know that you're not that you're hydrated, then you want to check. Okay, the urgent need to urinate. You can't hold your urine. That's another sign. That could be a sign. Cloudy urine, blood in the urine, pain in the abdomen and groin or lower back. That's also a sign of prostate problems. Pain in the area between the scrotum and the rectum, that the area that we call the perineum. Pain or discomfort of the penis or testicles, painful ejaculation, fever, chill, muscle aches, or flu-like symptoms with, and that would happen with certain types of infections. So these are some of the things that may be possible symptoms of prostate issues. So you want to see a doctor if you cannot urinate, if you find that you want to urinate and it's not coming, you want to go to a doctor right away. You don't even want to wait. Painful or difficult urination accompanied with fever, that's another situation when you want to see a doctor right away. If there's blood in the urine, you want to see a doctor right away. Severe discomfort and pain in the pelvic area or genitals. Once if you're experiencing that, you want to go right away to see your doctor. So those are some of the things. If there's anyone want me to go over the list, I can go over the list and share with you. Okay. All right. Okay. Someone is asking in the chat before I go further. Someone is asking in the chat, is there something like having too much sex for a man? How often should a man ejaculate? Interesting question. One of the things that I've learned when while studying the prostate is that studies have shown that men who ejaculate, I can't remember the figure, but men who ejaculate, certain amount of times during the month, they have been known. And according to the studies, if the men, when the questionnaires were done, if the men were honest, it will show that if they were honest in answering these questions as to how often they ejaculate, and based on the results that were found in research, if they were honest, there is an indication that men who have reasonable amount of ejaculations. I'm trying to remember. I need to get that information again, but it shows that having ejaculation at a certain amount of month have been shown to reduce the risk of cancer. So, I know there are different reasons why there may be problems with having sex in the marriage. Some, there are different psychological and psychological barriers, emotional barriers that will prevent the wife from, wanting to have sex, what a man may consider frequently. But we can probably talk about that a little more. But the point is here is there is such a thing as having too much sex. I remembered when I was in a certain country, and we were doing some lectures on health, and I was dealing with the immune system and prostate health, and a few of the women asked the question. So there are two things I observed. One was that a lot of the men in that country at a certain age were having prostate issues, really bad prostate issues. I've never seen it like that anywhere else. Anyway, so here you have the men talking about asking these questions. They were interested in prostate health, and then the women, the questions the women were asking, and it was amazing. It was not just one or two. Quite a few of the women asked the question, "How often should I have sex?" Some women would ask me, "Is it okay to have sex every day?" and things like that. And I look at the women; they look distressed when they were asking the questions, and I know, and I suspected that the reason why they were asking these questions is because the men were, I will say, intemperate or being sexually overactive. I believe that there's a someone said here in the chat, everything in moderation. Too many ejaculations could cause deficiency of zinc, and not just zinc, even selenium, which helps with the heart and the immune system and other things. So I do believe that there is such a thing as too much sex. Some men, they want to have sex every day. If you wanted to have sex every day, based on my understanding on the anatomy, I'm going to say sexual anatomy and physiology and biology, then something is not right, because I think the body takes 3 days to replenish the sperms, to where it relates to sex drive. I think it takes 3 days for a man to become replenished. So I think that a lot of times men who want to have sex want to be intemperate, who feel this high sex drive where they, it's like all that's on their mind and is sex, and they're so sexually stimulated, is because they are using things, maybe herbs or supplements, some kind of thing that's increasing, that's given, resulting in abnormal sex drive. There's some men, once they reach a certain age, they in order to make sure that their wives are sexually fulfilled, they take things. You can find a lot of things that will cause you to be sexually, cause a lot of sexual stimulation. And I know men that do take a lot of those things. I've heard stories, and I've heard a lot of stories, and based on what over the years of dealing with married couples with sexual issues, I have reasons to believe that a lot of times men overdo it. Yes. Okay. So someone posted here, a man needs at least 2 hours to build up his semen levels. Yes. So he should ejaculate at least the most 3 times a week. Too often can result in zinc deficiency and problems with the eyes. Yes, I definitely believe that that too often can cause not just those deficiencies, well, those deficiencies plus the issues that come with those deficiencies. Okay, another something else in the chat. The men lose zinc and needs to rebuild over a few days, but when does a woman lose? Okay, what does a woman lose? Well, with any kind of activity, I can't tell you specifically. I don't remember, but I do know that there's that nutrients and other things are lost when it comes to the woman. You do lose something. I can't tell you specifically, but if there's anyone that have any information on that, we can share. So okay. So now I want to touch on something here quickly. So the men, there are times when men men are not the only marriage partners. It's not just the men who sometimes are, what should I say, overly sexually stimulated. There are women who go through that also. And again, it's because of hormonal problems. So many things can trigger, um, what I should say, unusual appetites for sex, things that you look at. Um, there are types of music that can excite the lower passions, the sex organs. So that's something you want to watch. The type of music you're listening to, they can have a major impact. Someone says women don't lose anything, they gain everything. Wonderful. Okay. That's coming from a satisfied wife. Um, yeah, what I was saying is that the music you listen to, the foods you eat also play a major impact where it comes to being sexually stimulated. The things that you read. A lot of people, I was surprised years ago when I found this out, that a lot of Christian couples, and it may be the couple or it may be one partner, one spouse who indulges in pornography. I was really shocked. And once you're feeding your mind on sex, it usually can cause you to be sexually overstimulated, and that can cause problems. So if you're a female who has no control, that will be hard for your husband. And I've known situations. I've had to help men who were married to women maybe 20 years younger than themselves, which is not really a good thing if it were, unless no, there's some situations where it works, it's beautiful, but there's some situations where the female maybe, for whatever reasons, overly, or not. I'm not even going to say overly um, sexually stimulated, because if you're 20 years younger than your wife, you are not in harmony with sex drive levels. So a lot of times men have to okay. Someone says here, correction, does not ignore the word are. I don't remember what that may be the response to. Okay. So yeah.
Above.
So yeah, go ahead.
The message above, I just made a correction to the statement I made about the woman's physiology against the man and how it's impacted.
Oh, okay. Oh, yeah. Okay, yeah. So, so to have to maintain healthy prostate for the married couple, both the husband and the wife should work together in making sure that the husband has a healthy prostate. Let me see here. So I went through some of the causes and the things to look for. Um, so the risk factors for prostatitis, inflamed prostate. Those risk factors include certain types of medications, certain types of infections, using the what you call it, the catheter can cause that. Some diagnosis and sampling of prostate tissue, biopsy, that can also cause inflammation in the prostate gland. So you wanna really make sure that you are living by the rules of health. Now, one of the things that I want to mention in this is anxiety and depression. Depression also can also cause problems with the the prostate health. So those are things you want to make sure that you have a healthy state of mind. You want to make sure that you have a healthy state. I'm going to say a happy, healthy state of mind. Managing stress is very important in maintaining prostate health. And one of the things with stress causes the release and build up, the increase of cortisol, the stress hormone, and that can cause your T cell, your natural killer cell levels to drop. In other words, your lower resistance to infection. So stress, whatever causes infection, stress can trigger that by lowering your immune system, your body's inability to deal with these infections. Okay. So at what age does the enlargement of the prostate start, and what can reduce the growth? Well, studies have shown that usually, the prostate grows in early pubic years. It grows, and then I think at 25 it grows a little more again. So the prostate is a growing organ, but there's a possibility that it can. There is a possibility because of negative lifestyle habits that it can become, it can grow too much. So that is something you want to watch where it comes to the prostate. Again, I want to emphasize that there's studies that have shown that there are lifestyle factors that may may prevent these issues that can come about with prostate problems. Someone said to me years ago, so are you going to have your prostate checked? I just turned 50. And I said to the person, and this is me, I'm not saying that you must do this. So since we're not giving out medical advice, we are just offering, giving information, offering suggestions. But the person, more than one male would ask me, do you do prostate exams? And my answer was, I would refer them to Exodus chapter 15 and 26. And I will explain, God has promised that if we are living in harmony with the principles that he has given us to live by, we're told, if you will diligently hearken to the voice of the Lord thy God, diligently listen to God's voice, do what is right in his sight, give ear to his commandments, and keep his statutes, we will be spared these diseases. And medical ministry page 221, it says, the creator of man has made the living machinery of our bodies. Every function is wonderfully and wisely made, and God has pledged himself to keep this human machinery in healthful action if the human agent will obey his laws and cooperate with God. So that is how I usually would answer that question. Now, there are many who may, be, and that is why I never like using the word, I never like saying the 8 laws of health, because there's much more than water, sunshine, fresh air, trust in divine power. It goes a little deeper than that, because stress and sleep deprivation are major factors. We tell people, when we talk about laws of health, we mention rest, but it's more than just resting. It's sleeping. It's getting quality sleep at night. When you get your full nights of your quality sleep, when you get restorative sleep, one of the blessings of restorative sleep is that cortisol levels drop, and when cortisol levels drop, your immune system, the function of immune system increases. So sleep is very important to not just health on whole, but especially since we're talking about prostate health, we're talking about prostate cancer and so forth. Sleep is very, very important. So you could be doing all the other things. You could be eating healthy. A lot of folks say, well, I'm a strict vegetarian, so I'm good. No, you're not. The only way you're good by being a strict vegetarian is if you're eating foods that you grow yourself using proper scientific growing methods, or if you are buying foods from someone or a place where the food is being produced in a healthy manner. If you're depending on the supermarket for your nutrition, then there's no guarantee that you'll be getting good nutrition from that if you're buying your food from the supermarket, and even if it's organic. I know, someone asked me not too long ago, we were at a potluck at church, and I bypassed the bowl with a salad. There's a nice big bowl with vegetable salad. And someone said to me, how come you promote health and you're not eating the salad? And I asked the person, I said, do you know where those vegetables came from? And the person said, what do you mean? And then I explained to them, if it comes from the supermarket, then it's not going to promote health for me. And I know there were members in the church who grew year round there, and I know they grew the foods according to the true principles of growing foods. And once I know, the only time I'll eat the salad is if I know those church members brought from their garden. Other than that, I would not. So I'm saying that to say, as far as nutrition, the nutritional aspect of obtaining the nutritional connection between the health of the prostate and nutrition itself, that can, it's better if your foods are coming from a good source. You might think, okay, yeah, it has been shown that good health, whether it comes to prostate health or health in general, one of the components, one of the keys to good health is to obtain your nutrition from a plant-based diet, a whole food plant-based diet. So you might say, okay, now, so I'm going to go and I'm going to buy more vegetables and fruits, etc. That's okay, but if it's coming from, it has to be coming from, a good source to in order for it to be healthy for you. Okay. So is there a time in life of women's development when they lose a desire for sex as compared to men who have never lost the desire for sex at any age? Well, I believe that there is, but the loss of desire for sex, when you think about how the body was designed, many people, I would say, I want to say most, but I'm going to say, yeah, most people who lost their desire for sex, let's say, at 50 years old, a woman should not lose her desire for sex. If you're at 50 or even 60 and you're losing your desire for sex, then it's because of some reason. There may be hormonal issue. There may be certain medicines you're taking. It could also be contributed by stress. If a woman is not in a happy life situation, she will lose her desire for sex earlier than she should, because there's a lot of relationship between our emotional life and our sex drive. Your hormones, all those things, all those. If those factors, those negative factors are present, stress, anxiety, you may have it. You may be taking certain medications for certain other illnesses. You can lose your desire for sex earlier than you should. And like I said, 50 years old, 60, there's no reason why you should lose your desire for sex. So those are things, again, those are lifestyle factors that you want to consider. What is the recommendation for correcting the bladder problem if this is the cause of urinary problem? Okay, there are exercises, and there are exercises, there's medication, there's exercises, and there are also natural things that you can do. It all depends on the variant factors. There could be so many things that may be causing the bladder to not function properly. Infection, inflammation, and so forth. So those are some things you want to address. But there definitely are ways to deal with it naturally. So any other questions? Okay, is there a correlation between prostate cancer? Is there a correlation between prostate cancer and smell and taste? That question I cannot answer because I'm not sure. that is something that I would have to look into. I've never heard anyone express that, so I don't know how to answer that. Okay. Any other questions at this time? As we going along. So, so my question is, I should say, the next question we want to answer is, what what one of the things that I would always like to recommend for men especially is that whenever because of the nutrients that are lost, selenium, zinc, and maybe other things, it's always important once you reach a certain age, you and if you may not be sure that you're getting a good portion of nutrition, so supplementing may be necessary a lot of times. Supplementing your diet will be helpful to make sure that your body is replenishing the minerals, for both the men and women, the minerals and the vitamins and whatever nutrients that you may be losing during that time. If you're a person who is experiencing stress, again, you want to make sure that your nutrition is optimized, because during stress you lose nutrients also. In fact, during any negative health condition, the body loses a lot more than it would under normal circumstances. So I recommend supplementing. If you are in a place where you can get certain blends, two of the brands that I usually recommend would be a brand called Source of Life. They have multivitamins and mineral supplements, really good whole food source. And another company that I recommend is called Solgar, Solgar. So Nature's Plus and Solgar. Nature's Plus, I use a supplement for men. Excuse me, they have a specific supplement for men. So that's the one I would use. I don't use it always. I use it especially when I'm traveling a lot. I'm not sure if I'm getting what I need. I know where in my home area where I'm getting good nutrition, but once I'm traveling a lot, I usually supplement my diet. And even when I'm home, once in a while, maybe for a week, I will take my vitamin and mineral supplement for a week, and then I'll take a break and do it again maybe in another 2 weeks. One of my daily routines, which I think I'd mentioned before, is to in the morning I make a blend of sea moss, oats, and I have a plant-based protein powder by a company called Garden of Life. I will do a blend of that along with my green powder, which is a combination of barley, wheat, and alfalfa grasses. I will do that, and again, along with that, I would do a zinc supplement, but I don't do the zinc supplement every day. I may do it once or twice a week. If I'm in a situation traveling and I'm exposed to places or people with the flu or common cold or any kind of contagious infection, I will make sure that I do my zinc, vitamin C. I do some 500. Normally, I would do 500 milligrams of vitamin C, but on extreme cases where I may be exposed to certain things, I will take 1,000, and then I'll do that again, like I said, for a week. If I'm traveling for 2 weeks, if I'm away, exposed to certain things, I'll do that. I'll take the 500 milligrams of vitamin C, the 50 milligrams of zinc for the duration of time, maybe 2 or 3 weeks. So those are things. Okay, is there an age where a man is at more risk, and an age when attained they are not? Usually from the time, again, in today's, your question does make sense. In today's world, you look at everything, the technology, things in the atmosphere. Our atmosphere is majorly polluted and poisoned. The food, the stress level, our stress level is at an all-time high because of life situations. Right now, food prices are going up, commodities are going up, and I mean, we can go on with a large list of things that that are impacting our health today. And the age, as I mentioned in the beginning, the age for a lot of common health problems are becoming lower. So I will say once you are once you are past 25 years old, um, it's very important to start taking care of or addressing issues, in this case, prostate issues. Issues that usually we would only be concerned about when we pass 40 or 50 or 60. I think once you pass 25, you should start, taking things in hand, start, considering, you know, adopting things in your lifestyle to address those issues. So that will be my be my answer to that question. Now, so the question comes in two parts. Is there an age when a man is at more risk, and an age uh, and an age attained when they are not? I think, like I said, we're going to be always at risk as long as you're living in this world. But beginning at 25, then is when a lot of things start to manifest. So yeah, and as far as an age when they're not, again, it's hard to say because of these different factors. I mean, eating that, put aside everything else, just our food alone. Just our food alone. That's our food and the atmosphere and stress. Those three things play a major impact on our health, and we're exposed to those in abundance. The lack of healthy foods, the pollutants in the environment, and stress. More and more young people are becoming very stressful at a very young age. And talking about stress, the stress, anxiety, and depression starts very early. Some of you might know that I talk a lot with family life and parenting. And just today I was talking with someone, and I was mentioning to them that children who are dealt with a certain way, 3 weeks ago I was talking to this man. He was 8 years old, bad heart, and I mean, all kinds of health problems, but including a bad heart. And he was telling me, because he attended one of my seminars on parenting and family life. And he was telling me that when he was a young boy, he was beaten severely by his father. And I mean, the kind of punishment that he described to me, I asked him, I said, your parents weren't Christians, right? And he said, yes, they were Seventh Adventists. And it's just amazing how we don't realize that when we deal with our children using such harsh methods, we set them up for not just behavioral problems, but we set them up for disease. I mean, in a major way, cancer or heart disease, because of the trauma that is produced when, from the time you raise a whip or a belt or a stick to hit your child, you start injuring their brain and damaging their nervous system, injuring their nervous system. And when you yell at them, you yelling at your children, you're beating them, you're being harsh and hard. You're not listening to your children, you're not reasoning with them. You cause brain injury, you cause nervous system injury, and you create stress that impacts their physical health as they grow older. And some people, they may be easier on the children young, but especially once the children reaches 13 and 14, 15, parents don't realize, that the mind of a child, a child's mind is curious and active. God designed the mind to want for learning And when a lot of times, most times when you tell a child, don't this and don't do that, the child asks why not. It's because they really want to know. Parents who are not aware of how the child mind and brain works, which I would say most parents, because most parents have not studied how to study the art of parenting and disciplining and so forth. They don't realize that a lot of times what we consider a child being rude by them asking why, it's not that they're being rude, it's that they really want to know, and they ought to know, because again, that's how God created and designed the brain for learning. Learning is part of our human makeup. And we set up our boys. We set up our boys for all kinds of diseases as they get older by the way we deal with them. And I tell you, so the young man was telling me, he said, at 15, I said to myself, I've had enough. And he ran away from home, got into drugs and alcohol and so forth. Years later, he came back to the church. But that what he has gone through in life as a young child, by what the parents call disciplining and training, that has affected him, not just by him going out and getting into drugs and alcohol and living a wild life, but even but further than that, that resulted his alcohol and drugs and so forth affected his health. But it just didn't start there. His brain was already injured from the trauma that he experienced as a child. So I'm just saying, for some of you here may have children, some of you are adults, but some of you may have children, and it's very important for you to take into consideration your children's health when you are disciplining or training them. There are ways to discipline and train without those harsh, unreasonable methods. Because again, like I said, you're setting up your child, you're setting up your son for major problems when he becomes older. And one of those would be prostate problems. Okay, any other questions? How is my time, Angela? Okay, any other questions at this time? Okay, so two things I'm asking. Any other questions on how is my time? Sister Angela, are you there? Okay, so one of the questions men would ask when it comes to the prostate, besides talking about supplements, usually men would ask about herbs that help. But again, as we mentioned, we're not giving out medical advice. What we share is not to diagnose, treat, cure, or prevent any disease. We just dispense information. I usually recommend herbs that will help to increase white blood cell function and increase the improve, rather, that's what I'm looking for. Herbs that will help to improve the function of the immune system, because our immune system is okay. So okay, I'm gonna answer that question about the PSA. So there are herbs that help to increase the function of the immune system, and when we have a strong, healthy, functioning immune system, the body is able to deal with a lot of things. The two of the herbs on top of my list would be something called astragalus, and the next thing would be echinacea. So those are two of my favorite herbs when it comes to making sure that I have a healthy, strong immune system. Now, I remember, this was about 40 years ago, there's a deacon in my church. He was about 70 years old. And, so it was, there were prayer requests for him. He had prostate problem back in those days, and I guess people still do, but, we will say, we say, brother, let's say his name was Brother Noel. Brother Noel had stoppage of water. And what that is that, he had an enlarged prostate, and his urethra was blocked. so the urine can pass through. And like I said, in those days, we call it in stoppage of water, meaning he can't urinate, urine is not passing. And so I went to look for him after church of Sabbath, and I just to pray with him, and he said, and he told me that he went and got some stinging nettle and drank the stinging nettle tea, and it cleared it up. And so years later, as I'm studying about herbs, I found out that the nettle plant is one of the plants that's recommended, one of the herbs that's recommended when with those type of prostate issues. So I just wanted to share that with you. If you think it's, I wouldn't recommend it with the part if you have urethritis, inflammation of the urethra, but it is one of the things that have been recommended for men who cannot urinate or who have a hard time urinating. Now, I will say to you, if you're having a hard time urinating, now for my deacon, he was urinating, but the flow wasn't good. But if a day passes you not urinating, you need to find an emergency room as soon as possible. You need to right away, immediately. You should go to the emergency if you're not urinating. Okay, so the nettle have been known to help with the flow of the urine, and as I mentioned, the echinacea and golden seal for immune health. For blood cleaning, I will recommend red clover tea. A lot of red clover tea will help. Have been known to help with that. Okay, so if a man has to do an operation, no, let's go to the one before. If I'm let me see. Over the PSA numbers, the PSA number should be, oh boy, under 0.1. I think under 0.1 is the normal. Once your PSA comes above 1, I think you should start looking into seeing what's going on. What are good numbers for the? Okay, so we answered that. Now, what doctors will tell you? Some doctors will tell you that high PSA count may not necessarily be something wrong. After sexual activity, the PSA is set to rise above normal. If they are a person with cancer, the PSA level could be due to dead cancer cells. So those are some of the things that we have been shown when it comes to the PSA number. But yes, I think above 1, I will start looking into it. And please correct me because I'm only going from memory and I may be wrong, but that's what I will start with. If there's anyone here that can give any updated information on that, please share it as far as the normal PSA numbers. Okay. All right, I'm gonna answer that. Okay. All right. About 4. Yeah, really about 4. For me personally, once it gets even below 4, I will start checking. But I think above 4 is the recommended numbers. Yeah. So if a man has prostate surgery 10 years ago, can it return? Yes, prostate problems can return. It's possible. So one may ask me, how can I prevent that? And again, going back to what the counsel that we given regarding the cause of disease. Disease is an effort of nature to free the system from conditions that result from a violation of the laws of health. So if we are, based on that statement, if we are living in harmony with the laws of health, the possibility of it returning may be minimized. But yes, it can come back. It has been known to come back. And usually when it comes back more severe. Okay, if a man has to do an operation to take care of prostate problem, will he be able to function sexually again? Yes, he can. I know even men who have removed their prostate, there are devices and on medication, I think that can help. Even if the prostate is removed, yet I think their devices and there's certain types of things that have been that medical things that makes it possible for a person to engage in sexual activity. I think that the issue comes when the prostate has been removed completely. But like I said, I have been told that I've been made aware that there are things that can be done to help a person to still, a male to still engage in sexual activity. The thing to do is to make sure that we're doing everything to prevent that from happening. Okay, any other questions or thoughts at this time? So we're talking about the herbs, and I mentioned the astragalus and the echinacea, the nettle, and where it comes to. So if you have prostate issues that may result in sexual dysfunction, the way to deal with it is to deal with the underlying problem, whatever is causing whatever is causing the malfunction, whatever prostate issues may be causing a malfunction. The way to go about dealing with that is to deal with the prostate issues. And once you do that, then whatever results in the prostate problems, as a result of the prostate problems, whatever the results from the prostate problems, that will be removed once that's taken care of. Regular exercise is also important for sexual health and prostate health. Studies have shown how regular exercise, men who exercise regularly have better functioning prostate health and better prostate health. Sleep is very important, and I want to mention restorative sleep. Okay, if a man never marries, is he at risk for prostate problems later in life? I think so. Yes, I think so. Because the thing about it is the prostate problem may not come from not having sex. There are other causes of prostate problems. So yeah, there are men who are not married, but they indulge in masturbation or even sex outside of marriage. So, but I think the question would be that if you're married, if you're gonna marry. Oh, wait a minute. Oh, no. Sorry, I'm sorry. Let me read it again. If a man never marries, yeah. The answer is yes. He can have problems later on in life because, again, as I said, there's so many different factors that can result in with prostate problems. And I know men. I have men who even in their 50s who engage in masturbation and very frequently too. So yeah, I think that's a risk for a lot of problems. Okay, I hope that answers the question. All right. Any other questions, comments? Is Sister okay, so the question is masturbation a sin? And that is a question that comes up a lot. I read some things years ago from the Pen of Inspiration where it's considered self-abuse. And so I don't think there's a cut and dry answer to this question. Personally, I think it's I'm not going to say it's a sin, but I will say that is it from what we told from Pen of Inspiration, and even from certain scientific findings also, it does affect us mentally, psychologically, and also physically. You know, there are people that have had certain kinds of health issues as a result of masturbation, but I know definitely with the mind, the, it affects the mind in a lot of ways. So if something that affects the mind or affects the health is a sin, then we can say, yes, it is a sin. So, yeah. And I'm surprised that I've had people tell me, I've had females tell me, well, I'd rather do that than go and commit fornication. I'm saying, well, basically, explain to me what's the difference. You know, yeah. So we might want to say yes, it is a sin. Okay. Oh, Angela's having technical problems earlier, and it might be the reason why we're not hearing from her. It's now 8:30, and we should stop. Okay. All right, then let's do that then. That's where
I am not having technical problem. I am here waiting for you to complete your presentation. And once you have done so, and you
okay, okay.
let me know, then
Oh,
I will come
okay.
in.
Okay. I,
So
cause
I'm right
I'd
here.
okay, good. All right. So yeah, so right now, basically, I'm dealing with some questions. So, are there any other questions or concerns? Are there any other questions I wanted to know, make sure I've covered everything that we need to know about the prostate? So if there are no more questions, I am just going to wrap this up. So ladies, gentlemen and ladies who are concerned about their husbands or their sons, once you see those, you remember those things that I mentioned in the beginning. Once there's any kind of abnormal situation where it comes to urination, um, especially with urination, burning urination, the dribbling or dripping while urinating frequently at nights, especially once you've passed 40, and you are experiencing that, or talking to the ladies if your husband is experiencing that, or you have a son, an older son who's experiencing that, it's advisable for them to see their doctor to have their prostate checked. If you're not, if you know that you're not being living a healthy lifestyle as far as your diet, exercise, sleep, if you're stressed and sleeping all and have sleeping issues, not eating healthy, it's recommended that, I recommend going, and you pass 40, I would recommend going and have your prostate check. There's nothing wrong in having the prostate check to make sure. Even I know men who are very strict vegetarians, as I mentioned, that have prostate issues, came down with prostate cancer. So it's advisable that once you reach a certain age to go and have it checked. It's the same thing with like how we recommend that ladies have their breast checked for breast health. The same way men go, I suggest going and get your prostate checked. And if you have discovered issue, then there's a plan that has been given to us. There's counsel given to us from the pen of inspiration from the Bible as to how to go about dealing with our health. Okay. And let me see, another thing I want to mention in wrapping up is husbands and wives need to, when it comes to sexual issues, because we want to make sure that your ladies, you want to make sure that your husband is, his sexual function is normal. You want to make sure that he's not sexually overactive, and these are things that we need to sit down and discuss. Men, if you I want to encourage you to please consider your wife's well-being where it comes to sex. If your wife is not having if your wife is experiencing low sex drive, low libido, then you need to have a conversation with her to find out what might be the problem, you know. And one of the things I do, I deal with, I help marriage couples with issues, including sexual issues. So if for any reason you feel impressed to do so and you're having any issues, just reach out to me and I'll be glad to talk with you and share. Okay, so our time is up. I'm gonna ask Sister Angela to give our closing comments and then we'll pray.
Okay, thank you. I take it there are no more questions.